Gallbladder problems such as gallstones are one of the most common problems we encounter both in public and private work. And the symptoms can be quite debilitating. Patients will have persistent pain in the tummy on the right side, which can significantly impact their quality of life, often needing multiple hospital admissions. Thankfully, over the last 15, 20 years, the standard of care for gallbladder problems, such as gallstones, has been keyhole surgery, that is laparoscopic surgery, and that's what I offer my patients. 95% of patients we are able to do surgery using the keyhole technique or the laparoscopic surgery, and that is what my current standard of care is for management of gallstones. The most important aspect from a patient perspective is, although they have pain in the tummy and they may have gallstones, the thing I have to make sure is the pain is actually coming from the gallbladder and gallstones. And that means also, although a scan like an ultrasound scan has shown gallstones, I often undertake further scans like a CT scan or an MRI scan to make sure the pain is actually coming from the gallbladder, because the last thing we would like to do is take the gallbladder out and the patient still has the pain. So the first thing which I would do is to make sure the pain is coming from the gallbladder, whether or not we need to do further investigations to make sure there are no other causes of pain. Once we have confirmed that, the next step would be to send the patients for an anesthetic assessment. Irrespective of age and medical problems, it's good care and standard of care for these patients to be seen by an anesthetist to make sure they're fit for a general anesthetic, because removal of the gallbladder has to be undertaken under general anesthesia. So once the anesthetist confirms that you're fit and able to have a general anesthetic to take the gallbladder out, then you're formally on the list to be able to undertake your gallbladder surgery. And we often endeavor to do the surgery as quickly as we can, because we know how bad the pain can be. And I know that, having the pain quite frequently means time off work, not able to do your regular activities, spend time with your family. So I try and endeavor to have the surgery undertaken as quickly as we can once we confirm the pain is coming from the gallbladder, and as soon as the anesthetist has signed you off to have your surgery. Every surgery has got the risk of complications, and gallbladder surgery also has risk of complications. The two most important complications we often talk about is the risk of having to do an open operation, especially in patients who have had previous abdominal surgery, if they had multiple attacks of pain in the gallbladder, and the gallbladder could be quite stuck to the adjacent bowel. And also if they had bad pancreatitis in the past, which is often pancreatitis could be caused by gallstones. So these are the group of patients where there is a small chance we may not be able to undertake the procedure using the keyhole or the laparoscope. And the risk of that is around 5 to 10%. So that's the most important aspect patients should be aware of. There is a small chance we may not be able to undertake this procedure keyhole. And the second important complication is damage to the bile duct during the operation. The gallbladder drains into the bile duct, and while we are trying to take the gallbladder out, there is a small chance of damaging the bile duct. And the risk of that is 0.5%, again, extremely small. However, if there is damage to the bile duct, there is a small chance again of having to make a cut to repair the damage to the bile duct. So these are the two most important complications when you talk about laparoscopic surgery. One is there is a small chance of doing an open operation, and there is also a small chance of damaging the bile duct. In the absence of any of these complications, if the procedure goes well, majority of the cases are undertaken as a day case. That means the patients come in the morning for their procedure and they go home the same day. And that is the advantage over traditional surgery. Traditional open surgery means patients would often be in the hospital for 3 to 4 days after their operation because of the cut. We have to wait for the cut to heal. And we also have to wait for the patients to be fully mobile before they go home. On the contrary, with keyhole or laparoscopic surgery, we can send home patients the same day, provided there are no other medical contraindications for them to go home on the same day. Recovery from gallbladder surgery is quite variable. It depends on a lot of aspects and factors which will determine how quickly patients can recover. The recovery for someone who is quite young, fit and quite able to do normal activities before surgery would be much shorter. On the other hand, if you have slightly older patient with other medical problems, the recovery would be slightly longer. But in general, if it's done keyhole and patients go home the same day, by the time they're ready for discharge, they're fully mobile in the ward, eating and drinking, mobilizing on the ward and able to take most of the normal activities themselves. So we make sure they're well enough and stable enough and safe enough to go home on the same day before they are suitable for discharge. Once they go home, again, depending on their fitness, most patients should be able to get back to normal activities within a week. That includes able to do strenuous activity like exercise, going for swimming, able to drive a car within 7 to 10 days, and within 3 to 4 weeks, their pre-existing quality of life should return. That means the quality of life they've had before they had gallbladder surgery in terms of activities and mobility should return within 3 to 4 weeks, and even better, if not to the pre-existing quality of life, because by removing the gallbladder, we're able to get rid of their pain. So we expect patients to have better quality of life than they had before their surgery. We expect patients to live a normal life without the gallbladder, because one of the reasons we're taking the gallbladder out is because that gallbladder is not working properly, either from stones or polyps or for a variety of reasons. So if it is not working properly, people would not be having a normal life. That means it would be severely affecting their life and their work, relationships, and their quality of life. So by removing the gallbladder, which is not working properly, we expect them to have a normal life. However, there is a small number of patients, less than 5% of patients, who may have some loose stools after the operation, which is again expected because the function of the gallbladder is to store bile. And when we take the gallbladder out, some of the bile which was previously getting stored in the gallbladder can go into the bowel, and that might give some patients some loose stools. But again, the bowel will get used to the new flow of bile into the bowel, and within 3 to 4 weeks, the loose stools which the patients have would normalize. So in the long term, we would expect patients within 2 to 3 months to have a normal life, normal quality of life without the gallbladder. And again, based on what's published in the literature, there are no long-term effects after removal of a gallbladder. In the long term, in terms of general life expectancy, we would expect patients to live and have a normal life expectancy without gallbladder.